This is a sagittal slide of a male, so cut down mid-sagittally. It shows the scrotum with the testes in it. This is your epididymis, which is part of the excurrent duct system. So the testes are your gonads in the male. They'll make the spermatozoa that will then leave the testes via the epididymis. End of the epididymis is continuous with the vas deferens or ductus deferens. That will then go over the bladder, come down past the seminal vesicles, which are on the back of the bladder. Seminal vesicles are an outgrowth of this duct, and they will secrete into the duct. The two ducts joining together form an ejaculatory duct that then goes into the prostatic urethra. The prostate sits right below the bladder. We saw that in the urinary system, about the size of an acorn. It's going to be secreting as well into the penile urethra. So you'll have the fluids that the sperm are in from the epididymis joining secretions from the seminal vesicle. Those will go into the prostatic urethra, and they'll be joined by secretions from the prostate, and then they'll go out through the penile urethra. Since the penile urethra is used both for a urinary system, which the pH of the urine is fairly acidic, and you've got all these delicate little sperm babies going into it, you don't want to acidify these very delicate little things, because they're already arriving outside the body about 45% DOA. So you don't want to increase that by having them hit an acidic environment. So there's two little glands that are in the floor, the muscular floor of the pelvis. They're called bulbourethral glands, and they secrete first before all this ejaculate hits the urethra, and those will lubricate and then change the pH of the penile urethra so that it's more alkaline and the sperm have a better chance of surviving. The penis in this position is not going to get anything out, too much curve. So it's got to erect and make a straight channel for the ejaculate to come out. It does that by engorging these tissues up here called there's two of them. Each one is a corpus, which means body, cavernosum, which means it's got a lot of openings in it. There's a cavernous tissue. You let blood go into those caverns, then the tissue gets very rigid. And as the penis goes up, then the inflow and outflow of blood is cut off, and you have an erect penis. To get the sperm out with the ejaculate, you've got to get smooth muscle to constrict, to push the sperm from the tail of the epididymis up through the vas. So there's a lot of smooth muscle there that will continue to move the sperm on. The secretions from the seminal vesicle and prostate, there's smooth muscle there that will squish those fluids out. So everything will join up together in this prostatic urethra and then go out through the erect penis. That is sympathetic nervous system. So erection is parasympathetic and ejaculation is sympathetic. We're going to see that the reason why the vas deferens is over the bladder, the gonads develop on the posterior abdominal wall, but they're going to go forward, pulling peritoneum, and then they're going to catch some muscle and go down into the scrotum, and you're going to end up with part of your abdominal obliques down there. You're going to end up with peritoneum down there, and some other muscles that develop down in the scrotum. The testes have to be in the scrotum because for spermiogenesis to occur, the testes have to be below core body temperature, at least 2 to 3 degrees. So they have to be outside the body wall. So gonads develop on the posterior abdominal wall. They're developing next to some kidneys that are called pronephros that aren't going to persist, but the duct system will, and it will become the epididymis. It will join with the gonads and form the excurrent duct system. As the system is developed, it starts to move away from the posterior abdominal wall and descend through the pelvic cavity, and by birth it should end up in the scrotum. The reason the kidneys end up in the scrotum. Okay, wake up. The reason the testes end up in the scrotum well, that might happen to somebody, but not most people, is because of this gubernaculum testes. And gubernaculum, I think of it as a little bungee cord. It's not very elastic. It's attaching the gonads to the inside of the scrotum. And as the body elongates, this little attachment doesn't. So it's going to, as the body elongates this way, it's going to pull the testes away from the posterior abdominal wall. And the testes are anterior and in front of the bladder. So the gonads go over the bladder, through the inguinal canal, and then supposed to be down in the scrotum. So here they've been pulled over the urinary bladder, they're gone through the inguinal canal, and they're headed towards the scrotum. So at birth, they should be down in the scrotum. If they're not, if they're still up in the pelvic cavity, you have prick orchid. So as the male baby comes out, they're checking everything and they kind of down in the testes. If they don't find a little ball down there, then they're going to check up in the pelvic cavity and palpate up there. You feel the testes up there, you know, you gotta watch this kid, see if in the next year or two or sooner, the testes get down into the scrotum. If you're approaching puberty and the testes aren't down there, then if there's one that's not down there, they've got one functional, they might be okay. But usually the parents will elect to have the kids surgically corrected, have the other one put down there. If both of them are up in the pelvic cavity, put both of them down there. Otherwise, the male child will be sterile. And that's kind of a bummer for guys. So they will surgically correct that. But they'll give the baby chance for the testes to descend on their own. Sometimes they go awry. They don't go down into the scrotum. Sometimes testes end up on the inner thigh. Sometimes they end up on top of the penis. So they're supposed to go in the scrotum, but sometimes they don't. As long as they're outside the abdominal cavity, they're usually able to produce sperm, at least as far as I know. Okay, the development in the male reproductive system, you have these para-mesonephric ducts, and you have a mesonephric duct that's attached, that's going to be part of the fetal kidney, and the fetal kidney is going to degenerate, and the duct system will persist the mesonephric duct and these duct systems will hook up with the testes and form the excurrent duct system for the testes. Paramesonephric duct, as long as you have an active SYR gene, you're going to secrete a substance that's called Mullerian inhibiting factor, or anti-Mullerian hormone, AMH, and that should cause the paramesonephric duct to degenerate. So it disappears by about 4 months. The mesonephric duct, which is part of the fetal urinary system, is now your excurrent system. It's going to form the vas deferens, and then the epididymis, and the efferent ductules from the testes. The prostate is going to develop from some glandular tissue that's not part of the reproductive system, but the urethra will be going through the prostate, and then part of this mesonephric duct will have an outgrowth, and that will be the seminal vesicle. The gonad will develop in the cortex, the medulla area of the gonad is going to form long tubules that are going to get more and more elongated. Eventually, they're all going to coil up. They're going to be in separate lobules of the kidney, of the kidney of the testes. So these are going to get more and more lengthy. They'll coil up in between septa in the testes, and that fetal excurrent system will form what's called the reedy testes and the efferent ductules. So sperm will be produced out here in the seminiferous tubules. So seminiferous, long word for where the sperm are made, and then seminal vesicle or gland for that accessory gland. They sound kind of similar, but very different functions. The epididymis will get longer and longer, and it will coil as well. Here you see the little tubules have coiled, and now they're all kind of wrapped around each other and shoved into little lobules in the testes, separated by invagination of the tunica albuginea will form these lobules. Each of those, if you went in there with a little tweezer or a little probe, you could tweeze out the seminiferous tubule, pull it out, and you'd see that it's one huge long tubule with a common exit. So you have a little straight tubule that comes out of these coiled seminiferous tubule in the lobule and joins up with the reedy testis. Reedy means network, and you look at the tissue there, and it's forming a network of channels. Those channels will join up with some more straight tubules. They're called efferent ductules. They're part of them. They're going to go into the head of the epididymis. The head kind of converges from 6 tubules to 1. Tubule that's also very highly coiled. That will go down the backside of the testis, and then one duct will come back up and head out of the scrotum. And that will be your vas or ductus deferens. So as the testes go down into the scrotal cavity, they're going to pull peritoneum with them. And that peritoneum is going to be called the tunica vaginalis. The surface of the testes will also be covered by tunica vaginalis, which is part of the peritoneum. And under it, you're going to have a white covering on the testes, kind of whitish gray anyway. And that's the tunica albuginea, so albino or white covering. You have in between the two tunica vaginalis, which are the peritoneum that got pulled with the testes down into the scrotum, you're going to have some fluid in this area. Don't want to have too much fluid, put pressure on the testis and could decrease sperm development. But you need a little bit because the testes are going to be moving around. You have this cremasteric muscle here. That's part of your internal oblique and maybe some of your transversus and some of your rectus abdominis. As the testes go through the inguinal canal, they grab some of that fascia and the muscle and pull it down with the testes. The cremasteric muscle will elevate the testes when the environment is cold and relax and lower the testes when the environment is warm. This is the way that the male ensures that the testes is kept 1 or 2 to 3 degrees below core temperature. Even in cold environment, the testes will be warm by coming closer to the body wall. In a hot environment, they go further away from the body wall. I had one medical student, male medical student, says, "Hey guys, remember when you were playing leapfrog and you were playing jumping over fire hydrants, and all of a sudden your little guys went up to your body wall?" Protective reflex as well. So if there's danger imminent, the cremasteric muscle will elevate the testes for protection. Doesn't always happen. Well, it's supposed to. It tries anyway. It tries to do the job. Okay. You have the superficial scrotal fascia. That's the fascia that's associated with the abdominal muscles that get pulled down with the muscle that's going to become the cremaster muscle. And then you have a dartos muscle. That's just smooth muscle, and it kind of crinkles the scrotal skin around the testis, maybe to kind of cuddle it and warm it up somewhat. It doesn't move it anywhere, just kind of contracts around the testis. And then you've got the skin. You've got the septum, where the two that will separate the two scrotal sacs, and that's called the perineal raphe. If you take a lobule and cut across it, and take a thin section through a lobule, you're going to see openings, so tubular lumen, and then you'll see all these dark nuclei.